warahmatullahi wabarakatuh. Hello everyone, I'm Alfiyatul Musabikhah. I'm from Nutrition Department, and now I'm going to give presentation about the mobile apps for hypertension in children. Before I start this presentation, I will tell you that this presentation will be held for 10 to 15 minutes, and if you have any question about this presentation, please submit your question at the end of the presentation. Thank you. So let's begin to talk about this topic. This presentation will be in 5 parts. The first, I'm going to talk about the definition of hypertension. Second, is the hypertension that occurs in children. The third is the factors of hypertension in children. The fourth is the common symptoms that may occur in hypertension in children. And the last is how to avoid hypertension in children. Okay, to begin, I'd like to talk about the definition of hypertension. Hypertension is an increase in systolic blood that exceeds 130 and diastolic blood pressure of more than 90. Which can be caused by several things, including age of patient and lifestyle such as smoking. Hypertension often goes unnoticed by people who suffer it. Even people who feel healthy can get hypertension without knowing it first. Hypertension is risk factor for cardiovascular disease. If this disease is not treated, it will have an impact on heart, brain, and kidney complications. Okay, now I'd like to move on to hypertension in children. Essential hypertension is hypertension that affects adults. This hypertension begins in infancy and can be identified in childhood. Meanwhile, the hypertension that commonly found in children is primary hypertension and secondary hypertension. Primary hypertension is hypertension that cannot be explained the cause, usually related to some factors such as heredity, salt intake, stress, and obesity. Secondary hypertension is caused by other underlying disease more associated with parenchymal and renal vascular disease. The third, I'd like to talk about factors that cause the hypertension in children. Factors that affect blood pressure in children include congenital disease, excessive food intake, and lack of physical activity. In addition, height and weight also have an effect on children's blood pressure because children who are tall and weigh more than their peers will have higher blood pressure as well. Now I'd like to discuss the common symptoms that may cause hypertension in children. Common symptoms that arise in hypertension experienced by children are headaches, dizziness, blurred vision, abdominal pain, vomiting, decreased appetite, restlessness, weight loss, and excessive sweating. And last, I want to talk about how can we avoid the hypertension in children. Hypertension in children can be avoided by consuming healthy foods, keeping children away from smoking, and adopting an active life by exercising regularly. In addition, the use of mobile applications can also be a tips for finding information about high blood pressure in children. With the increasing use of smartphones today, there are also applications that provide information about health, or what is commonly known as mobile health. As in hypertension, there are currently many applications available to monitor blood pressure, risks of hypertension, and recommendation for diet in hypersensitive sufferers. One application that can be used is high blood pressure hypertension diet help. You can see the picture here. The high BP hypertension diet help application is a free mobile application that can be accessed through the Play Store on Android. This application is designed to raise awareness in hypersensitive patients. This application also contains information about high blood pressure, such as causes and risk factors, or recommended foods, and what to avoid for people with hypertension. This mobile application also has been reviewed by a professional nutritionist. The main part of this application are a risk factor of high blood pressure, foods related to hypertension, signs and symptoms of hypertension, tips to avoid hypertension, cause of high blood pressure, and consultation with a nutritionist. This mobile application also has the facility to directly contact a nutritionist if we want to consult about nutritional related issues, and can also get a personalized diet card according to the complaints we are experiencing. Users of mobile application for hypertension in children are more emphasized on their parents. Parents of children with high blood pressure can monitor or seek information about high blood pressure in children, and can even directly contact a nutritionist about what the diet should be done. The advantage of using a mobile application are the users can access health information anytime and anywhere without need for face-to-face with nutritionists. Another advantage is that it reduces operational costs because users do not need to directly visit the hospital and register. While the weakness of the mobile application are that the success depends on patient compliance and knowledge how to use the mobile application. Another drawback is the mobile application requires a stable network, so it can be used more optimally. So, hypertension doesn't only affect adults, but also in children. Therefore, we must be accustomed to implementing a healthy lifestyle from an early age to avoid hypertension. So, you choose consult with nutritionist in person or using mobile application. That's all from me. If you have any question, please write your question in the comment below. Thank you very much for your attention and see you guys. Wassalamualaikum warahmatullahi wabarakatuh.